So listening to Inspiration 92.3 FM, your number one family radio. It's time for Drasa Half Hour. And we have two amazing guests in the studio. For those of you who are just tuning in to the show, it's a public health awareness program that features every single Wednesday at 11:30. Drasa stands for Dr. Ameyo Stella Adadevoh, just like you heard in the ad that we play. The courageous doctor who identified as the first Ebola patient in Nigeria in 2014, who later died after contracting the infection from the patients. And, her actions saved the lives of millions of Nigeria. Today, we're going to be talking about facts about hand washing and how we can promote hand washing in our homes and communities. Before the headline news, we were talking about how it is important to wash your hand before scratching your eyes. We had the eye doctor talk about eyes and, things to prevent you damaging your eyes. So you need to wash your hands before you eat. So I'm glad that we're talking about this today. Our guest today in the studio is Moyo Shori. Our first guest is Moyo Shori Odumesi. I got that correctly, right? No, I didn't. She boldly said it that I did not. Odumesi. Kafaya Omo Yoruba. That's such a disappointing thing. Odumesi is a project associate at Drasa Health Trust. She has experience in managing health projects and mobilizing communities to take actions to better improve their health. You're welcome to the studio.
Thank you.
And she's not a new person, but I'll introduce her. She is Dr. Christine.
Just leave me my nursing profession.
Not Christine. I love the way you said it. Leave me my nursing profession. Nurse Christine Akowa is a project associate at Drasa Health Trust. She's certified. She's a certified midwife, nurse midwife, with over 3 years of experience in clinical nursing, school health, and management of illness and diseases, with focus on ensuring wellness in both rural and urban communities. It's good to have you both back in the studio. So we're talking about the facts about hand washing and how we can promote hand washing in our homes and communities. Yeah. It's always very difficult to get people to wash their hands. It feels like it's a chore.
Yeah.
Why?
My sister.
I think maybe from the facts that we'll be sharing today and some of the things we'll be sharing today, maybe to support people and to ginger people to wash their hands more.
Yeah.
Let's see. Because the one thing that I know that got everybody on every class start washing their hand was COVID.
Exactly.
We don't have that kind of situation to force people to start washing their hands again.
Amen.
I would expect amen. So let's talk about the facts.
Yes. Thank you and good morning to all our listeners out there. So, as far as we know, hand washing remains one of the most effective ways to keep ourselves free from germs and infectious disease. But as a people and as a country, where are we with this very simple practice? And it's very important as well.
Yeah.
So now I'll be sharing some facts with us about hand washing. So our audience out there, please listen and take notes for us to learn and to also win big with Drasa as well.
Okay.
Now, to these facts, they may sound a bit surprising to some of us, but did you know that if every one of us should wash our hands regularly, as we should, an estimated number of 1 million deaths a year could be prevented? Like 1 million people, thousands of people, thousands of deaths could be prevented if all of us should wash our hands as we should. So can you imagine that? I feel like this is definitely something for us to think about, because despite the situation of the economy and the country, nobody wants to die. At least not soon. We all have dreams and aspirations that we hope to achieve. So imagine that some people have lost their lives, or even some of our loved ones, just because they did not wash their hands, or they've died due to some disease that could have been prevented by simple hand washing. Something that should be like a second nature to us, like hand washing should be something that's is very something that we practice regularly. I feel like this act is unforgivable if anybody dies just because you did not wash your hands. Like 1 million deaths could be prevented. This is not just a mere number. It stands for like lives, people with dreams and aspirations that have just gone like that. So I think we should also consider that. Another interesting fact is the two most important times that we should wash our hands. I think we talked about 2 weeks ago during one of our radio sessions. Two most important times to wash our hands, which is after using the toilet, when you urinate or you poo, and before eating or cooking our food. And now, why? Maybe some people are thinking, why just these two important times out of the whole time? This is because after using the toilet, of course, you're exposed to germs. You just finish passing out waste, and you can get germs on your hand. So imagine you just finished pooping and you did not wash your hands, just came out of the toilet, and then you just shake the next neighbor that you are seeing. You shake them, you hug them, and transfer that germ to the other person.
And those who sell fruits on the road.
Exactly. And that's how you just swallow germs in your mouth and get sick. So I think this is why we consider, out of all the times, these two important times, we should make sure before you eat your food or before you cook your food and after using the toilet. Don't forget to immediately you're coming out from the toilet, just go straight to wash your hands. Now we've looked at that. Now let's look at where we stand. Where are we as a country? How do we compare to other parts of the world in terms of hand washing? So according to the World Health Organization, about 4 in 10 schools worldwide do not have basic hand washing facilities. And when I say basic hand washing facilities, I mean soap, clean running water, all these small basins where people can just wash their hands. And in Nigeria alone, 9 out of 10 schools have no place for children to wash their hands.
That's the problem.
This is actually not good. It's not good enough, because we know we've been kids, we've been children, and we know how children can be playing around on the playground, touching different things and using them. And I remember me when I was in school, I was told that always wash your hands. So imagine teaching kids, but you don't have those facilities for them to wash their hands. You're teaching them to always wash their hands, but you don't have
wash their hands.
Exactly. And it's important that children are taught or encouraged and provided with basic facilities to wash their hands, because you protect the children from falling sick and also missing school. You know how many children will miss school? Mommy, today my head is spinning me. Today I'm coughing. Tomorrow I'm stooling. I'm having diarrhea. All those can be prevented with hand washing. You can prevent absenteeism by just washing.
I don't know why we don't practice preventative.
Exactly. You shouldn't be until there's a disaster and there's a problem. Exactly. Now, what about our hospitals? I think last week we also talked about key moments and key times that we should wash our hands within the hospital environment, both as healthcare workers and as caregivers. Now, in the whole world, worldwide, 1 in 3 hospitals do not have hand hygiene facilities in the hospital.
That's terrible.
While in Nigeria, 4 in 5 hospitals do not have hand washing facilities.
That's terrible.
And it's not good enough, because we have doctors and nurses and other healthcare workers that are performing surgery, testing, treatments, and they might not be able to wash their hands because they don't have it's either you go to this hand washing station and there's no soap there, or there's no clean running water. You can imagine that. So imagine as a patient now, you're going to the hospital to just maybe get your appendix out. I know maybe a few of us have experienced this, or you're a pregnant woman going to give birth, and you're picking up a serious infection, something entirely different from what you went in for. You went to remove appendix and they're telling you now that you have a new infection just because there's a loophole somewhere and somebody could not get to wash their hand when they should before attending to patients or before touching a sick patients, as the case may be. So why am I sharing this information? I'm not just bombarding us with statistics or trying to put fear in our hearts. We shouldn't panic, but it is for us to understand how important this hand washing. A lot of us, we are taught, we know that we should wash, and we should be aware that this has a lot of benefits, and we need to make deliberate efforts. Actually, it's not just for us to blame somebody and say it's the government, they did not put it's somebody. As a people, individually, to make things work, we have to put your own quota, do your own, make some effort to encourage hand washing. So stick around. When we come back, we'll discuss some of the solutions to improve hand washing.
We'll be back, guys. Don't go anywhere. It's close. And you get to win something as well. All right, very soon you get to win amazing prizes from JASA. All you have to do is just answer 1 or 2 questions, and you are, I wish I could play because I want to win something. But we'll be back. Don't go anywhere.
Join Dr. Ameyo Stella Adadevoh, Draza Health Trust on Inspiration 92.3 FM Lagos every Wednesday from 11:30 a.m. to 12 p.m. for the Draza Radio Half Hour in celebration of Global Handwashing Day. They will be sharing stories and practical tips on how your hands can keep you healthy and prevent infections from spreading in your home and community.
Come on everyone, keep healthy, keep healthy. Come on everyone, keep healthy.
You are still listening to JASA Half Hour right here on Inspiration 92.3 FM. For those of you who are just joining us, Dr. Ameyo Stella Adadevoh, what JASA stands for, Health Trust. They've been sharing some facts about hand washing. And nurse not doctor. Christine is going to tell us more about that.
All right, thank you, Kafayat. Okay, let me just start up from where Moyo left, just to introduce us to the next discussion we want to share with everyone.
Okay.
So, something caught my attention when she said pregnant women. Remember when we talked about Ignace Smilewell's the problem in the hospital? He realized some persons were washing hands, some persons were coming out from autopsy place and all of those things. Yeah. Now, the importance of this discussion is so that we know that hand washing should be a habit. It should be what we do every day. It shouldn't be just because I'm not falling sick, I don't have to wash my hands and all of that, right? So this morning, I'll just brief us. Most of us like hot amala, ati ewedu plus olishirishi roundabout, yeah. But there is an African proverb that says, when a child knows how to at least wash their hands, they eat with the elders.
Yeah.
The reason for that is because hand washing is very important. There is no way we can separate, just like we can't separate air going through us so we can breathe. We can't separate ourselves from hand washing if we want to be safe and live healthy lives. So we want to let everybody know that there is something called initiating behavior. Right? They say before you do something, there should be behavior change. So we need people to understand that one important aspect for us to actually just know that hand washing should be our habit. We need to initiate that behavior. And we want to talk about the social norms, that is the manner, the practice. Let's see it as part of our life routine, something we must always do. We can't separate ourselves from it. And in this aspect, let me just give a brief example. Say many Nigerian cultures, right, they have this tradition: before you eat, you wash your hands, right, just to remove dirt from the hand before they eat their food. That's the belief. Normal, it's not the proper hand washing way, but they should have included soap and all of those things, but they just do it because they don't want to eat unhealthy. Same thing applies to when you remove your shoes. Some culture have that before you enter their houses, I beg, remove your shoe before you come inside with dust and everything. But I still need us to know that the same thing applies to hand washing. If we can just align our minds to it that way, it can become a thing we should do, not something we just have to do. It should be. Now that's how it's supposed to be. I won't even switch to PG like this, because they need to know that it's a very important practice to take as what they should be doing every time. So if we talk about this, COVID-19 gave us that experience. Everybody was scared. Wash hands.
Everybody was washing.
In fact, if you check the price of salt, it's increased because where everybody wants to make sure their hands is spotless. Sanitizer price increased. Why? They need to be healthy. They don't want to die. The same thing should still apply now, because the same measure that was applied during COVID-19 is not what I'm seeing. Supermarkets, markets, banks, schools, churches. It's not done that way. So the first point I'm talking is the social norm. It should be a practice. It should be a habit.
Not wait for a disaster to happen.
Exactly. That's the first part. Then the second part, let's talk about the environmental cues. When we say environmental cues, we're trying to respond to what can we do in our environment that can motivate us. You understand? At least if I'm going to a restroom, maybe I'm going into a facility and I'm trying to visit their restroom. Is there any signage that I can see that can remind me, that can motivate me? Yes, to wash my hands. So when we talk about environmental cues, that's what we are referring to. In this aspect, there should be a working hand washing facility with liquid soap and clean running water. It should not be one item missing. Everything should be intact. Why? Because we want to initiate that behavior. We want that practice to continue even when COVID has gone. You understand? So that should be something that should be done in our environment. The reason why is because you cannot force a horse to the stream to drink water. Even when you force the horse to drink water and the water is missing, the horse will not drink water at the end of the day. So we need to know that hand washing in a stable physical location, convenient for people to wash their hands, is important. We have businesses. You can implement that. We should not wait for until the government do this, until the government do that. We can do it ourselves. It's a community thing. So if we as people, we as Nigerians, we as a community do not implement that, we will still be lacking behind while others are moving forward, implementing hand washing as a thing. So we shouldn't just wait. That's working hand washing facility should be in good place, in good position to encourage people to wash their hands. Signages, just put up signages like maybe a watching eye, watching you, like, okay, I'm seeing you, you just use the restroom, you are not washing hand, bend down, wash your hand there. You understand? Just anything to motivate hand washing. So that's just a brief point I just need us to know. The social norm, it should be a manner, a practice, and then the environmental cues, that is the the thing we can see in the environment that can motivate us to continuously wash hands. So
hands.
hand washing is very important. We should not trivialize it.
Somebody
That's
has a
just
question
it.
here, and someone
Yeah.
said, please, what about the tiny dirt and bacteria hiding on the long nails? Because, everybody now,
That is why
especially ladies that fix nails and do all of that, when you wash your nails,
My sister,
really
it's
doesn't-
aesthetic, so.
It doesn't get in here.
So
That's why I hate long nails. I cannot.
Exactly.
do long nails.
They
Advice
need to
have
short nails.
short
Yeah.
so I can get into all the.
And I
nooks
think one of the
crannies.
steps, the
Yeah.
hand washing steps, if you remember, is like wash
your
your
fingertips.
fingertips.
Wash
Yeah,
them well.
Now, if you
Yeah.
keep long nails, how do you do that?
How do you wash
So
it?
you
Yeah,
can't
It's actually
effectively
advised
wash your
for us to
fingers.
keep short nails.
Yeah. Yeah.
Really long nails.
Please, let's tell the person, please, sister. For
All those
aesthetics,
beautiful sisters with long.
just give us short nails, please.
All right, fantastic. Thank you so much, Zubi. So it's time for people to win on the show.
Yeah.
All you have to do is call the number right now. All right. We have about 10 minutes or 11 minutes to go. 0700 923 923 923. That is the number to call. 0700 923 923 923. That is the number to call if you want to win something from Drassa. What did they stand to win?
We have the dresser hygiene kits, and
It's
we
a
have
Drassa hygiene kit.
Turkish towel inside. There's a nice water bottle,
Yeah.
T-shirt,
Thermometer.
thermometer. Then there's we have hand washing material, like the
Yeah.
hand sanitizer, the hand sanitizer for
liquid
hand
soap,
hygiene,
yeah.
and the liquid
Can't I
soap.
go to the other side and call and try to win? Let's take this. Hello, good morning. I'm saying good afternoon. I'm in a hurry.
Hello,
Good
good
morning.
Good morning.
Yes, what's your name?
My name is Uche. I'm coming from Surulere.
Uche from Surulere. Are you ready for your question?
Yes.
All right, Nurse Christine.
Okay. Which number do you want to pick?
We have number 1 to
From
6.
number 1 to 6.
Number 3.
Okay. According to the WHO, how many deaths could be avoided every year if everyone washed their hands regularly?
It's 1 million deaths.
Oh, shit. Oh, yeah, send us your number.
So, Uche, first, don't go yet. Don't go ahead. Send us your name, your phone number, all right, and send us your location. Send it to the WhatsApp number right now, please.
Please, can you call out the WhatsApp number?
So the WhatsApp number to send it to is 0817 313 6193.
Okay.
Okay, but you have to send it right now
Yes,
while we're
sir.
still in the studio so we can take your details down. All right?
Okay. Thank you.
Thank you so much, Uche from Surulere. Thank you for calling. 0700 923 923 923. We are looking for how many more winners? 4 more winners.
4 more winners.
Let's do this. All right. Hello, good morning.
Yeah, good morning.
Good morning. What's your name?
Yeah, my name is Emmanuel Egwatu.
Your name is?
Emmanuel.
Emmanuel. All right, Emmanuel. Are you ready for your question? Calling from Lagos.
Yeah. Before the question, sorry, I won some 3 weeks ago.
Yes. We've been expecting you.
We didn't get your phone. We didn't get your details. Please, can you do that?
Okay, so when you win on the show, if you don't send your details, you don't get
We'll be
anything.
able to contact you.
So
Yes.
please send your details to our WhatsApp number right now.
All right.
All right. Do you have the WhatsApp number?
No, please call it from me.
Okay, so let me call it for you. It's 0817
All right.
313
All right.
6193.
Okay. 9:30.
Yeah, so please don't wait till afternoon or evening. Please send it right now while we are here so we can take it down.
Okay.
Uh-huh.
So which number do we have?
You want to win again?
Let us win now.
Let them sort your gift out, then you win the next time. Thank you very much, Emmanuel.
Emmanuel is loaded.
Hello, good morning.
Hello, good morning.
Hi, good morning. What's your name?
My name is Nene, calling from Adadevoh Estate.
Nene from Adadevoh Estate. All right, are you ready for your question? Are you ready for your question?
Yes,
All right, Nurse Christine.
Okay, from number 1 to 6, question 3 is gone. Pick a number.
Okay, number 4.
All right, number 4. According to the WHO, how many schools out of 10 have hand washing facilities in Nigeria?
4 out of 5.
She got it.
Please, we give it to her.
We give it to her. We're giving it to
That's
you.
for the worldwide though, but thank you. It's not for the Nigerian one, but yes.
She's gonna take it.
Yes.
So you've won. You've won. Congratulations, Nene. So you have to send us your details. See, don't say thank you without sending us your details. You have to send your details
I'll
now.
send it right away.
Send it to the WhatsApp number. You have the WhatsApp number, yeah?
Yes, I have
Okay.
it.
Okay. So please send your name and your number, full name and number. Okay.
Okay,
Thank you. Thank you so much, Nene. All right, 0700 923 923 923. That is the number to call. All right, if you want to win something totally amazing before we go on a break. All right, let's see if we can take this call. Okay, let's take this call.
Okay.
Hello. Hello. Good afternoon.
Hello, good afternoon.
Bobby, good morning, Jenny. Good morning. What's your name?
Good morning.
Yeah.
Zubi calling.
Zubi wants to win. Zubi from our papa. All right, Zubi, are you ready for your question? Zubi, are you ready for your question?
Yes, I'm ready.
All right, go ahead.
Okay, from question 1 to 6, question 3 and 4 is gone. Pick a number.
Question number 6.
Okay, according to the WHO, out of 5 hospitals, how many have no hand washing facility in Nigeria?
Those are comments and 5.
According to the WHO, out of 5 hospitals, how many have no hand washing facility in Nigeria?
How many?
Zubi, Biko, we gotta take more calls. Call me back. I don't know what's wrong with your line. Hello, good afternoon or good morning. Hello, can you turn off your radio, please? What's your name? Turn off your radio, sir. This simple rule. It's not Kiddie's Corner. Hello.
Hi, good afternoon.
Hi, good afternoon. What's your name?
My name is Precious from Similarity.
Hi, Precious. You sound very precious. Are you ready to answer your question?
Yes, please.
All right, fantastic. So,
Okay, question 1 to 6, pick a number. 3 and 4 is gone.
Question 2.
Question what? 2. Okay. Explain the 2 ways that we can improve hand washing behavior or practice in Nigeria.
I think that.
Explain the 2 ways that we can improve hand washing behavior or practice in Nigeria.
By providing hand-washing facilities in schools, hospitals, and
Okay.
everywhere else.
One more.
And what's the second one?
she's asking.
I can't remember. But it's just by providing the facilities and encourage people, like putting notices
Yes.
at
Notices. Yeah.
places like toilets or something.
Precious.
Okay,
Don't
thank you,
worry, you got
Precious.
it. Precious, please send your details. Please send your details to the WhatsApp number right now. All right, your name, your full name, and your phone number.
Okay, I will. Thank you
Okay,
very
but,
much.
yeah, you're welcome. But please send it now. Don't send it in the afternoon or much later. Send it right now. Okay.
I will.
All right. Thank you, darling. Congratulations again. Do we have time to take another call? I think we do. Hello. Good afternoon. Oh, we lost that one. All right. Let's see. Hello. Good afternoon.
Hello, good afternoon.
Hi. Good afternoon. What's your name?
Yeah, this is a calling again.
You have 1 minute. Oh yeah. Question.
Okay, we have 1 to 6 questions. Question 2, 3, and 4 is gone. So pick a number.
Question 5.
Okay. What are the 2 most important times to wash our hands?
What are the 2 what?
What are the 2 most important times to wash our hands?
Okay, if we wash our hands immediately after toilet
Okay.
and before eating our meals.
Awesome. Well
I
done.
didn't get the name.
What's your name?
Yeah, Zubi,
Zubi. Okay, Azubi K.
from my papa.
Okay, Zubi from Apapa. All right, thank you so much for calling, Zubi. Remember, send your details to the WhatsApp number right now, okay?
Yeah.
All right, thank you
All
so
right,
much.
thank you very
All right,
much.
bye, and we're out of time. Final word before we
Yes,
go?
yes. Thank you for listening and joining us on today's episode of Drasa FR. Once again, we are Dr. Ameyo Stella Adadevoh Health Trust, Drasa for short. You can follow us on our social media channels, Twitter, Instagram, and Facebook. Our username at Drasa Trust, DRASATRUST, or our website www.drasatrust.org. We want you to be a part of our 53,000 plus health champions in our network who are always taking charge of their health and helping their loved ones and community do the same. So if you're listening out there, either you're a leader, a father, a school or hospital administrator, or anywhere, and you're in the position of making decisions, please let's take note of the social norms and the environmental cues, and provide hand washing facilities in our respective offices.
All right, we got to go. Thank you so much. We'll be back same time next week by the special grace of God. Congratulations to all the winners. Coming up at 12 o'clock is the world news.
Inspiration 92.3 FM.
Your inspiration.
Let's go.